So, could you please explain the relationship between genetics and heart attacks and what role genetics plays in the risk and occurrence of heart attacks?
So, in our genetic clinic, we commonly see two types of patients coming to us. One is when they have multiple members in their family being affected with heart attacks. They are concerned that are they themselves are at risk, or maybe some others, their children or their siblings might be at risk. They themselves might not be having this disease, but they are concerned because of this family history. The second type of patients that we have are they themselves have had heart attacks either at a young age, at a very young age. They might not have smoking or any other common risk factors, but still they got a heart attack, mostly commonly at a younger age. And also patients who have had multiple heart attacks with although they are on medications, they get repeated heart attacks. They have been mild till now, but they are concerned if it can repeat again, maybe can it be worse the next time. All these concerns happen. So this is where the role of genetics comes in. The usual causes of heart attacks and the risk factors might not be present in them, but still they are getting these heart attacks. Their family members are getting heart attacks at young age and they are concerned. So the role of genetics comes here because other than the common risk factors that we see, there is another factor which is usually missed. That is the genetic part that plays a role in these heart attacks. It does not happen always, but around 20% of such heart attacks which are unexplained otherwise have been attributed to different forms of genetic conditions.
Doctor, in what ways can genes influence heart health and contribute to the risk of heart attacks?
Before answering that, we need to understand what genetic diseases or genetic conditions are. We need to understand that all parts of our biological functions, that is, all the biological functions in our bodies, are being taken care by different forms of proteins. For example, in our eyes, we have lots of different proteins working together. In our hearts, in our kidneys, in our liver, in our skin, everywhere we have hundreds of proteins which are actually working together to make it function properly. Similarly, we have in the heart also different proteins which leads to its structure, its rhythm, its strength. All those things are being managed or controlled by different proteins. And where do these proteins come from? These proteins are generated based on the codes in our DNA. So genetic disease just means that there are some variations in the DNA which leads to the variations in these proteins, and these variations lead to different conditions, right? So heart is a very complex structure, right? So it has the muscles, it has the nerves for the rhythm, it has the vessels, the size of the vessels has to be controlled, and many different things are come together to form a normally functioning heart. So all of these proteins, any of these proteins can be affected by the genetic disease. The most common ones that we see are the type of diseases called familial hypercholesterolemias. We recently had a case. He was in his early 30s only. The thing was that he was already detected to have hypercholesterolemia, that is high cholesterol levels, even when he was as little as 16 years of age. Till now, people have been ignoring it because he was too young. People used to say that he is too young to have this cholesterol disease, and no particular management was done. Very recently, he got referred to me. We did a genetic testing and we found that there is a mutation in a very common gene that we see associated called the LDLR gene. And because of that mutation only, he has been having high cholesterol levels. The thing with this particular disease is that these cholesterol levels become very uncontrollably high. It leads to depositions in the vessels and leads to heart attack, as you might already know. And the thing is that we have different medications also for it. If we hadn't picked him up at this time, he would have gone on to having these high levels of cholesterol and at a very high risk of having heart attacks early. But we started him on the right medications. The thing is that these cholesterol levels are not very easily managed, so we might have to add multiple medicines and all. But finally, we were able to bring down the cholesterol levels, and he is at a much lower risk of having heart attacks. So this hypercholesterolemia is one thing that we commonly see. That is because of the increased cholesterol levels, right? The second type we commonly see is the cardiomyopathies, which means that the muscles become weak and thickened and not beating properly. Again, a very common type of genetic heart disease that we see. They are very prone to have exercise associated heart attacks. We might be seeing in the news and in the different sports and gyms and all. We know that many people during their workouts have had heart attacks, during dances have heart attacks. All these, not all those might be related to this hypertrophic cardiomyopathies, but a huge chunk of such cases are actually because of this genetic cardiomyopathies. Third type of genetic condition we often see is the arrhythmias. So we know that the heart has a particular rhythm to it, right? And that is being taken care by a very intricate channel of different nerve-like structures. So if there are some changes in the proteins in that, it leads to the abnormal rhythm abnormalities in our heart. That is also a common cause that we see. Sometimes we also see, so another very common type of condition that we see is what we call as connective tissue disorder. That is because the vessels, the blood vessels coming out of the heart, right, they have to be strong because they are exposed to very high pressures when they pump out this blood. But sometimes the walls of these vessels become weak because of the certain proteins which are meant to hold them together are not as strong. A very common condition that leads to this weakness is something called as Marfan syndrome. The heart vessels become weak and it balloons out, and finally it pops like a balloon, and it can lead to a heart attack. Many times people are labeled as heart attacks, but many of the times when an autopsy or a postmortem has been performed in such cases, we see that the rupture of these vessels is what has caused this disease. The another form of common heart attack genetic type is what we call as thrombophilia. What is thrombophilia? Thrombus means clot and philia means a liking, which means that our blood has a very liking to form clots. So even though our vessels might be normal in size, easily forms clots, and if these clots are forming in the heart, it leads to heart attack. And the major thing is that most of these conditions have very good treatment options, and we can prevent these heart attacks in most of these cases, but we have to identify them on time and keep on screening these individuals.
Doctor, who is most likely to benefit from genetic testing?
Yeah, so whenever we see a family who has this kind of a history, or some individual who has such a history which is doubtful of a genetic condition, we typically look for any red flags. Red flags means that those features which alert us to look for particular genetic causes in a particular family. So what we usually look for in families is men who are less than 55 years, if they have had heart attacks. In women, 65 years is actually considered as a young age to get a heart attack. Otherwise, someone has had heart attack multiple times, milder heart attacks on multiple times at a very young age. Even sometimes we have had children who had heart attacks also. And also in many cases in routine checkups, heart checkups and executive checkups, people pick up some heart anomalies or heart wall thickenings and all are very commonly seen, whom we evaluate. Also, like we said earlier, for thrombophilias, they are at increased risk of developing clots. So they might not have had clots in heart yet, but they might have had strokes, clots in the leg or lungs, and those people in families where sudden unexplained deaths have occurred, because many a times what we see is that someone dies in their sleep, or someone has unexplained sudden collapse and death. In many cases they are not evaluated well, and when multiple of these people occur in the same family, we have the suspicion that this might be of a genetic origin. In all these cases, we recommend that either the person who is affected or the close family members be tested for the genetic causes. The right person to be tested is either the person who has had the heart attack or first degree relatives of them, which means either the parents, siblings, or the children. They are the ones who are most at risk of developing a similar condition, and those are the ones who ideally need to get tested.
Doctor, what can genetic testing reveal in cardiovascular disease and what are its limitations?
Yeah, so one more thing that we need to understand is that a lot of times people are exploited, or people are given false hopes, or false marketing has been very commonly done in the genetics market to get these genetic testings done for the people so that they can assess their risk. The problem with that is we need to understand the limitations of these genetic testings as well. So whatever genetic testing we do, even if it is normal or abnormal, it will never tell you for 100% certainty whether or when you are going to develop a genetic disease. The very common analogy that we use in a lot of these cases is regarding someone who is driving a car. We can never predict whether he will get into an accident or not, right? But what this genetic test will do is it will check the brakes of the car, which means that if the brake is failed, you are at a very high risk of getting into an accident, right? And there are methods to fix broken brakes. So that is what we do. Even if your brakes are normal, you can still get into an accident. Similarly, even if a genetic test is normal, it does not mean that you are never going to get a heart attack. Everybody is at a low risk of getting heart attack. Even me or everybody who are listening, all of us are at a very low risk of getting heart attack because someone has to get it, right? But a genetic form of heart attacks means they are at a very high risk of getting heart attacks, which means 80%, 90% chance of getting heart attacks unless they are given the treatment they need. So that is what we are trying to find out. So even if you have a positive report, it does not mean that you are anyway going to get it, but we can have multiple methods of prevention which we can use to bring down your risk. Even if you have a negative report, it does not mean that you will never get a heart attack, but it means that you are not genetically at a high risk of getting these attacks. So that is what this particular test can tell you. If you are at a high risk, is there some medications or some preventive measures that you can take to do it, but it does not say for a 10% surety whether you are going to get it or not. So this is not a horoscope or this is not a prediction of future. It's just a form of risk assessment so that we can manage your risks accordingly.
Doctor, how do genetic test results practically influence patient care and clinical decision making?
Whenever we do a genetic test for such an individual or a family member, then we can expect two types of reports, right? Either it can be positive or it can be negative. There could be ambiguous results also, we'll talk about it later. But if it's a negative report, so it helps us alleviate a lot of anxiety in these family members. So recently we had a mother who had visited our OPD. She is around 45. She has had two recent tragedies in her family. That is, her husband expired at, I think, close to 50 years of age with a heart attack, and a young son who was only around 25. He also expired very recently. He had a silent attack when he was asleep, and the next morning they found him lifeless in the bed. And these two were very tragic incidents for this lady, and her main concern was whether her second son, he is also at risk or not. Obviously, we did not have the samples and not much test had been done in the other two individuals. So we were able to take a genetic test for the surviving son, and we check for all these different types of genetic conditions that can be associated with the sudden cardiac arrest. We were not able to find any genetic issues in him. So either this was not a genetic condition that was running in the family, and both of them has had some other reasons for their deaths, or they both had the genetic condition but this particular son was spared. Anyway, we were able to share this good news with the family, and now the anxiety of the mother has been alleviated to a huge extent now. Anyway, we are going to continue surveillance for this son for the normal risks, and he obviously has to take care of his lifestyle and not indulge in smoking, and all those things are still there. But genetically, we now know that he is not at a high risk of getting any of these cardiac events. So that was regarding the negative report. So what happens if the report is positive? Does that mean that you will anyway get heart attacks? No, we have already discussed that. So it will depend on what particular protein is affected in your case. If it's thrombophilia, like we said, it means that your body has a very high liking making clots in your vessels. We have both medicines and injections available to prevent those clots from happening. Sometimes we might find a gene for arrhythmia having the mutation. So we have medications which will help bring this rhythm back to normal. if you have had cardiomyopathies or the weakness of your heart muscles, we have medicines to bring down the pressures so that we can support these heart muscles. Sometimes a minor surgery might also have to be done, but most of these procedures can prevent the heart attacks or cardiac events from happening. If you have had hypercholesterolemia or the vessels are ballooning, all these have surgical methods or medications available which will help you bring down the root cause of these events and prevent them from happening in you.
Doctor, people hear the word genetic and assume the worst. So, what are the biggest myths around genetics and heart disease that you would like to clear up?
Yeah, I think the most common myth or the misconception regarding genetics of heart diseases is that if it's a genetic condition, there is no treatment. Anyway, there is no treatment, then why should we get tested? These are the questions that we often hear from the patients. But like we already discussed, there are different types of genetic conditions. There are different type of genetic causes for getting these heart diseases. It's true that we cannot completely cure them. It comes from the DNA. We cannot go into the DNA and correct it. We cannot completely replace these proteins from outside and make it functional. All these things are not possible. It's true. But what is false is that we cannot prevent these things from happening or the disease from showing up. So we have already discussed how in hypercholesterolemia and in cases of cardiomyopathies and in cases of this dilation of blood vessels, in all these conditions, thrombophilias, we have specific medications that we can give which brings down this risk. We have also discussed how certain surgeries are also useful in cases of cardiomyopathies in bringing down this risk. So it's true that there is no complete cure in cases of genetic disease, but nothing can be done. That is not true. So we have already saved the lives of many individuals by identifying this risk and starting them on the appropriate management. So another myth that we commonly see, or the misconception, is that if it is genetic, it should have started in the childhood. But most of the times, these heart diseases we see after 20 or 30 years of age, because these proteins, the defect in these proteins often takes time to present. For example, in the cholesterol case, the cholesterol, even if high, it will take some time for the cholesterol to deposit in our vessels and occlude it, right? And the blood clots also. In the earlier ages or in the childhood, the clots are small and it usually does not occlude a vessel completely. But as time increases, these clots accumulate and lead to these diseases. The heart vessel weakness. Initially, although it is weak, the child is also small and the weight of the individual is also small, so it is able to compensate for it. But as the individual grows older and the weight increases and more the heart is made to pump with the weak muscles, the worsening happens. So it is not true that it can only happen in the childhood. It is very common that we see such genetic conditions coming up or presenting at a later age. So another common myth that we often hear is that even if a particular heart disease is genetic, once you maintain your lifestyle, do not indulge in smoking and do exercise regularly, and all those lifestyle modifications can still prevent a cardiac event. It is true if there is no underlying genetic disease, doing all those lifestyle modifications can help you reduce the risk of cardiac events. But if there is an underlying cardiac genetic condition, all these things would be still needed to bring down your risk. But in addition, you will need some sort of support. Like we already discussed the different types of heart attacks that can happen in genetic conditions, right? And how we treat all of these conditions. So it's obvious, right, that although you can do all the dietary and lifestyle modifications, but unless the underlying cause or the condition is treated, you are still at a higher risk.
Doctor, can you walk us through what the genetic testing process looks like?
So whenever a family member or an individual approaches us for this risk assessment, the first thing we do is to gather as much information as possible. Who all are the individuals who are affected? How they are related to you, at what age they had this disease. If you have some reports, that will also be useful. Are there any echo or ECG or thrombophilia workup reports? Anything that you have can be helpful. Once we go through all this, we'll draw a particular pedigree or a family tree and calculate what your risk of getting a similar condition is. Once we have that, if you are at a low risk, many times we might not have to do a test in you at all. But if you are at a higher risk, or if you are found to be at a higher risk, based on what particular condition we are expecting, we would prescribe the appropriate genetic test for you. It is a blood test. We take the blood sample and we do the DNA extraction and sequencing. Sequencing means reading the sequence of your DNA, and then we try to find out if there are any sort of mistakes or defect in the DNA. Based on what we find, we would recommend the appropriate management for you. Usually, we check all the genes which are associated with this: heart vessels, the muscles, the thrombophilias, cholesterols, and everything. And we screen all the other genes also once to find out if there are any major changes in any of them. Based on what we find, we would recommend what particular medications or surgical planning or surveillance plan that you need. Many times, for younger individuals, we also give them a preconceptional counseling, which means that if they are at a risk, are their children also going to be at risk? If the couple is planning pregnancy, is there a way in which we can prevent this from passing on to the next generation? All those things are also discussed in addition to the management.
Doctor, as we wrap up, what key advice would you give listeners about using genetic information responsibly?
Yes, so as we discussed, once we do a genetic testing done, we might be able to find out very high risk factors in you and initiate the appropriate treatments. But another thing that you need to know is that this technology or the genetic sequencing technology has been widely adopted only in the past maybe 5-6 years. And the technology is still evolving and there are many limitations like we already discussed. So just because you have a positive or a negative report should not demotivate you, nor should you underplay any risks that you have. We have had situations where people trying to quit smoking would take this genetic test and find it to be normal and shun their idea or their will to quit smoking. So that is not what we intend by this test. So that is not what we are expecting or intending to do with genetic testing and genetic management. This would only be an addition to whatever other managements and other tests or other workup or other surveillance and other lifestyle modifications that you are already doing. But if you feel all these red flags that we have already discussed before, if you feel that you might have one of these, it is important that you consult a geneticist and get his opinion to assess what particular risk you have and how a genetic testing can help you get a precise risk and manage that risk responsibly.